What's up, you guys? This is Boy Miguel giving you your daily dose of radiation. Today's video, we're covering the different type of X-ray / nursing students you have to deal with and work around in the emergency room. So to give you context, I do night shift X-ray at the hospital. Been doing it for 4 years, 7 on, 7 off. I work a lot of day shifts, so I dabble with the day crews and whatever endeavor they have. So as far as students goes, our department of X-ray has occasionally they have their trauma rotation, as we call it, which I think it starts like at 2 all the way to like 11-ish, kind of. And then the nursing students do go overnight. And essentially what happens is your own little student that joins you, usually they're not that bad. Usually they're just asking a lot of questions, trying to get their hands on, and depending what level student they are, year 1, year 2, how much they can help you or how much you'll have to actually teach them as far as how to do the work could vary. Usually most of them are eager to learn and are willing to, trottle on as being a student, and you can help them and you can show them tips and tricks, and, they'll in return help you, will assist you with certain stuff. Sometimes they will try to do it, they can't, and then you just kind of step in and do it. The nursing students, sometimes a direct work, it's kind of different. The times I've had to interact is mainly in day shift, but sometimes in night shift, since it's completely different worlds. And my lady's a nurse, so I've asked her many questions of their education as far as what we do and vice versa. And most of them, unless they're actually a nurse or have dabbled in some level of radiation, they don't get taught the dangers of radiation. So some of the nursing students, more of the younger ones, will go in there, do everything, and they'll just be right next to the patient. They're like, okay, so you're going to shoot the X-ray? And we're like, well, there's radiation, da-da-da-da-da. You might want to step back. And then they're like, oh, why? And then you're like, your thyroid, your da-da-da-da-da-da-da. They're like, for real? I didn't know. So, most of them don't know. Usually, that only happens if they're by themselves. But if they're with another nurse, they'll be like, hey, come on, get out. Da-da-da, let X-ray do this and that. So usually, it's kind of occasionally we do get confused by them because we wear the same level scrubs where we work at. The nursing students wear the same color scrubs we do, but they have a little patch. So occasionally they'll come up to us and be asking us a nursing question. And you're like, yo, you see this badge? You see this? We're X-ray. Different crew, different boat. And they're like, oh, okay. Sorry, my bad. So occasionally that does happen. We really don't. Occasionally they'll be in the room doing something, and then if you step in and you're like, hey, we want to do that, they usually step out. They're more because they don't want to get in trouble. They're usually more working around compared to the actual nurses in the ER. It's kind of different. They might not step out. They might just work with you, or occasionally they'll be like, no, you just got to come back later type situation. But usually with both nursing and X-ray tech students, usually they try to get along. Everything's peaceful. Occasionally you'll get some confrontation, but that's kind of situational based off of the characteristic of the person. Some feel entitled, they're about to graduate and they feel like they're at the same level as you, who are certified, who kind of knows the deal, and they may challenge you and stuff like that, which ain't nothing wrong with that, especially if we all make mistakes and stuff like that, and we're not always right. So if they catch it, it's always good, but sometimes it could end up some confrontations. And yeah, it's been your Boy Miguel. See you on the next one.